rapidly evolving in our province, our country, and around the world. As we continue to follow the best available evidence and the learnings from other countries, we know that ebbs and flows are not unexpected and should not be mistaken as a sign that we are out of the woods. As I've said many times before, we are still in the early days of this virus, and we have not yet seen the full effect of COVID-19 in our province. Another cluster like the one we experienced in March could put us right back where we started. Having said that, today gives us hope that with our continued unwavering efforts, we can surpass COVID-19, protect our vulnerable populations, and help spare more families from the pain of losing loved ones to this disease. In addition to the public health orders implemented over the last number of weeks, today I am issuing an order that will prohibit personal care home staff to work across multiple locations, unless required in exceptional circumstances. This measure will help further reduce the risk to residents and staff, as outbreaks in similar facilities in other jurisdictions have been devastating. I would like to acknowledge today the incredible efforts of our public health professionals in this province, those of you who are working tirelessly each day and to slow the spread of COVID-19 in our communities. We know that detecting the virus early, testing, isolating, and tracing every contact is essential in containing COVID-19, and without your expertise and quick action, the cluster we experienced in our province last month could have been much larger and likely more difficult to contain. This is a true indication that our public health system is responsive and working as it should. While our public health officials continue to do their work, we must all continue to do ours as well. Please stay at home as much as possible, especially if you are unwell, and only go out for essentials when absolutely necessary. Wash your hands frequently and well, practice safe social and physical distancing, and proper cough and sneeze etiquette. We know from our own experiences and those around the world that these measures are undoubtedly our best protection against COVID-19. Over the last few days, it has become apparent that more and more people are out moving about. And I understand the public health measures that we have in place are challenging. So far, people have stepped up, and we have seen the impact such measures can have. It is important to remember that the public health measures we have in place are for the protection of us all. I cannot stress enough that the low numbers of new cases in the past few days is not an indicator that we are on the downturn of this. If you relax your physical distancing measures now, I assure you that in 2 weeks, we will be in a very different place. So please continue to adhere to the principles of physical distancing. Do not go out unless it is essential, and stay home if you are unwell. As the weather improves, it is understandable that people will want to be outside, and I strongly advise you to stay in your own bubble and at a safe physical distance from others. As a recap for those who may have just joined us, we have no new cases since yesterday's media briefing. The total number of cases in our province is still 244. By health region, we have 227 cases in Eastern, 8 in Central, 3 in Western, and 6 in Labrador-Grenfell Health. With our continued efforts, there will come a time when we can resume life as we know it. How quickly we get there will depend on each and every one of us. If we continue to adhere to the public health measures in place and remain united in our fight against COVID-19, there most certainly will come a day when life will resume as we know it. But how soon we get there will depend on all of us. Our collective actions will have significant impact on how COVID-19 progresses in our province. Thank you.
Well, good afternoon, everyone. So you have just heard from Dr. Fitzgerald that we have no new positive cases today. That's exactly what we wanted to see today. It's exactly what we want to see every day, tomorrow, and well into the future. This tells us, as Dr. Fitzgerald has said, that you are listening to the important health guidelines that we put in place. And we want to thank you for that. And we've been saying that the results are completely dependent on your actions. But, and yes, there is a but, that does not mean in any way, shape, or form that you can let up. We are still in a public health state of emergency. So please do not let these results or the warmer weather, as Dr. Fitzgerald just said, lead you to believe that we're heading back to normal life, at least in the short term. We are not. We must continue to remain vigilant so none of you or us we spread this virus. We do not want you to be the vector, because you all know now that the virus only moves when you move. Is this a sign of hope? Of course. If you want to stop the spread of this virus, well, just keep following the guidelines. We do not need a setback. We can do this. Be patient. We need you to stay focused. We are in a health crisis that is putting strain on the social and economic well-being of our province. This includes the way groceries and medications and essential goods come into our province. Now, yesterday we saw public reports about OceanX, and they say that they supply about 75% of the freight that comes to the Northeast Avalon and about 50% of the freight for the rest of our province. OceanX has been talking about changes in their service delivery to Newfoundland and Labrador. And from last night until this morning, we've had numerous calls with Marine Atlantic, with the trucking industry, and with local wholesalers. We are exploring every option. Now, if you remember, a few weeks ago, we declared the trucking industry an essential service in Newfoundland and Labrador. And that was exactly for days like we are seeing today. And once again, I've heard from many truckers, and they are willing to step up. They say that they have capacity within the system to meet the demands of our province. Also, I have had many conversations with Minister Seamus O'Regan on this issue. And we both know that this is too critical to ignore, and that the federal government is looking at all options to make sure the supply chain stays in place. We need to remember that although OceanX is a big supplier and they're a big mover of goods, we also have Marine Atlantic. And they too, Marine Atlantic, they have capacity in their system, currently with 2 ships that are currently tied up and ready to respond. And even with the ships that are moving on a daily basis, there is capacity within that system. So we have the trucking capacity and we have Marine Atlantic capacity, and both are willing to step up. So we will continue to follow this closely so that Newfoundlanders and Labradorians have food security during this pandemic. We will always be there to respond to all the issues that come up during this crisis. So stay focused on the guidelines. And remember, continue to shop just once a week for essentials. It is important that we all stand together in this extraordinary time and we take every step that we can take to support our citizens. We've been at this table for weeks, as you know, and we're telling you things that you cannot do. But today I'd like to talk to you about some things that you can do. Pick up the phone and call someone. FaceTime, Skype, and Zoom are all wonderful tools. And we've been telling you to use them. But let's not forget about that simple phone. There are many seniors in our communities that are living alone. And for many of them, the physical ties have been cut off during this health crisis. They're not able to sit at the tables or kitchen tables and have a sip of tea or a coffee and having a chat with family and friends. There are seniors in our province that do not use technology, or they do not have the family support that others can count on. So you know what would be really nice today is for them to hear a familiar voice. So if there's one thing that you can do today, is call someone. Call someone that has left an impression on you. Someone on your street, a family member, someone that you haven't talked to in a while. And just let them know simply that you are thinking about them. We must never forget the ability to communicate by phone. It is a powerful tool. It's always the little things in lives that people cherish the most. It's the little things that sometimes have the deepest and most meaningful impact. There are thousands of residents that are tuning in right now for this update, and we want to thank you for joining us. And I really want to take a moment to say that I hope you're doing well. And I want you to know that with confidence that we are doing whatever we can to support you during this health crisis. If you're feeling stressed or a little anxious, remember there are important resources that we have available to you. Visit bridgethegap.ca, and that is gap with 2 P's. It's there that you will find resources for both youth and adults, and it's there you will find support for your mental wellness. You're not alone, and we are here for you. It is by working together that we will see change. So the time is now. Stay focused, stay committed. Let's continue to support one another as we stop the spread of COVID-19. Dr. Haggie, turn it over to you for a few comments.
Thank you, Premier. I think it would be very unwise to draw too many conclusions from the figures we've seen over the last couple of days. On the one hand, they do, I think, represent the success of traditional, old-fashioned, as it were, public health measures. But again, it is really too early to leap to conclusions and think we see a light at the end of the tunnel. We have a long way to go. Our report card, as the Premier referenced yesterday for Easter, is not yet here and will not yet be here for another week or maybe 10 days further down the line. We need to hold that line. All I can say today that I haven't said before is please stop looking for loopholes if you are. Thank you to those who have held the line and done their part, and stay in your bubble. Thank you very much. Premier.
Thank you, Minister Haggie. We now turn it over to the media for questions.
Thank you, Premier. For the benefit of our speakers, we have 8 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions. We suggest that you not ask rumor-based questions because the purpose of these briefings is to address COVID-19 issues only. All other government issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. We will run through the telephone queue, and I will call on each reporter by name. Please do not press star 1 until your name has been called. Following this, should time permit, reporters will be individually asked for single questions. This call will end at 2:59 p.m., and further questions can be emailed. Our first questions today are from Peter Jackson of The Telegram. Please go ahead.
Hi. You just announced the plan, which you alluded to a few days ago, about workers not moving between long-term care homes. Is this will carry the force of law, I assume? And what sorts of penalties would people be looking at if they didn't actually adhere to?
The order today relates to personal care homes, and they are generally private businesses. Like any other order, they carry penalties for both the business itself and for the owner, operator, and manager of those facilities. I don't think, given the discussions that my department's had with the personal care homes, this is going to be a matter of enforcement. This is going to be a matter of encouraging them and helping them to meet what is a challenge. They have a workforce that has in the past been able to rely on part-timers, and that fills a need for the economy of some of the communities, because some of these homes aren't very big. So the challenge is how we can craft a solution there that fulfills the requirement of the order, because at the end of the day, the order is based on sound public health. We have seen, and it was quite publicly stated yesterday and before by Dr. Tam, that over half of Canada's deaths relate to long-term and personal care home residents, and that is a group we need to protect.
Okay, thank you. The other thing is we're a week out from the release of the COVID-19 projections, and I'm seeing a lot of cases of people who, despite your admonitions, say the numbers are going down. Why are we not treating this as if the numbers are going down? And obviously, a lot of it has to do with the cluster. Could you explain again why this cluster should not be included in the projections?
So the cluster happened very early in the course of the outbreak here in Newfoundland and Labrador, and we had a lot of people, 177 people, that tested positive as a result of that cluster. So what we're seeing now, the cluster has been investigated, and we found most of the people that are related to that, and we've managed to be able to see that come under control. So what we're seeing now is just a baseline level of testing and positive cases as a result of other exposures. So we have to think that we're still quite early on in this, and we are going to see more cases as time goes on. So that's why we're asking that people still continue to adhere to the public health measures that we've put in place, and that you physically distance, wash your hands frequently and well, stay home unless it's absolutely necessary to go out, and certainly stay home if you're unwell.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Minister Haggie, you said yesterday following the briefing you would be having a meeting on fishery. Wondering if we can get an update on that meeting.
Certainly, that was a meeting between officials in my department, public health, and staff from fisheries and land resources. We have now concluded that internal piece, and we've moved into an external phase of communication. Over the course of the next day or two, we will be meeting from a health perspective with the fish harvesters representatives, workers in representatives in plants, as well as industry, to try and get a common level of understanding for ourselves in public health and health in general as to what working in the fishery, be it harvesting or processing, actually entails. And then at the end of that, we will hopefully have some common ground, and we will be able to issue some informed guidelines or orders if a fishery is possible.
So Kellyanne, maybe if I could just add a few comments to that. This morning I did have a call with, a chat with Keith Sullivan, of course, with the FFAW. And I think everyone expresses the concerns and feels the concerns about having the fishery in a safe manner. And of course, for us with the guidelines that are in place, it's incumbent that any fishery to proceed would have to be able to do so in a safe manner. Right now, it's very difficult to understand, how that could happen in this environment. But we know that the federal government and with the provincial government and with FFAW, they will make a decision. It's the federal government that eventually will make the decision on this, working very closely with the FFAW, and the federal government will receive input from the FFAW, people like, Mr. Sullivan, and plus, plant operators as well. So, the focus here for us is if there is a fishery to proceed, the decision will be made by Ottawa and working closely with the stakeholders that are directly involved in this. But the guidelines, for any industry or for anyone that goes to work here would have to be followed. How you put a mechanism for, physical distancing, proper hygiene, hand washing facilities in those plants, as an example, or on a harvesting vessel. These guidelines must be kept, and we must make sure that these fishery workers operate, if indeed they do operate, would have to be in a safe manner. Very difficult to, see a way through that as it exists today. But, we'll leave that decision to the federal government and those that are involved.
Thank you. With today's newest announcement about personal home care workers not moving from home to home in terms of work, and we know that yesterday's announcement regarding long-term care homes, are we still seeing a transfer of residents between homes?
It is not intended that residents would have to move. These are, after all, where people have chosen to live. The idea is that the staff would be working solely from one facility and not doing a few hours in facility A and then moving to B or C over the course of a day or a week. Certainly in long-term care, the RHAs have had clear guidance on that and have been working through it. And as I said, as recently as this morning, we had a very productive, very collaborative meeting with the Personal Care Home Operators Associations, and they were really keen to do this. They recognize the challenge, and we're not intending to move residents, we're intending to not move staff.
Thank you.
Our next questions are from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
Thank you. I was wondering, what's the status of the plan to expand the local lab testing capabilities?
The lab, in terms of testing capabilities, those have expanded in terms of the ability to process samples. Our limitations around samples are really set by the criteria. And if you recall, just over a week ago, those criteria were expanded on the basis of looking at the occupation of people, because we recognized there were areas where we needed to focus outside of straightforward contact tracing. So, for example, anybody with symptoms who worked in a hospital or paramedic or correctional facilities, and there were about 9 or 10 of these categories, would be tested. As of a couple of days ago, the criteria changed yet again because of the Public Health Agency of Canada, on advice from experts, altered the criteria for making a tentative COVID diagnosis clinically to include any 2 from a list of 7 symptoms. And it removed from that list things like shortness of breath or respiratory difficulties, which had limited it to a more severely impacted group of individuals. So it was looking for milder disease. So from our point of view, we are in conjunction and in parallel with other jurisdictions in Canada, still using focus testing, but our groups and the criteria have expanded. Lab ability to do tests is only limited by swabs and reagents, and at the moment we have sufficient for at least 9,000 tests.
Thank you. And following up on testing, Alberta recently announced it's expanding its testing to people with just symptoms. In the future, could our province move in that direction as well?
I think one of the things is we need to look at this in a dynamic way, and we need to be guided by evidence. So as that evidence changes, we will change our policy. And you've seen changes in the past. Some people have regarded this as uncertainty or lack of decisiveness. But what you're actually seeing is good public health at work, reacting to new evidence promptly and incorporating that very swiftly into protocols, often within 24 hours, in a way that's not been seen in traditional healthcare delivery for decades. This is a positive, nothing but.
Thank you.
Our next questions are from Ben Murphy of VOCM News. Please go ahead.
Thank you. Mr. Haggie, with the Easter report card not coming for another 7 to 10 days and some 120 complaints to the RNC over the weekend, you said previously the police believe the education tool is working, and you've delivered the same message now for a month. But is it time to bring down some more strict measures for those groups of people who just aren't listening?
I think that is an issue of enforcement. Enforcement is properly and appropriately one that we leave with law enforcement. There is no politician that can or should influence who gets accosted, arrested, charged, or counselled by the RNC or the RCMP. They have the discretion, they know what the orders say, and they are the ones with first-hand experience. Quite honestly, the approach of both main bodies of law enforcement has been around, firstly educate, then encourage, and only then enforce. And as yet, for the reports that they've received and the investigations that they've concluded, my understanding is neither of them have felt on the need to pass on to that ticketing threshold. It's a tool that's there if they need it. I would much prefer that they can sit their COVID unit and be relatively inactive. But that's not the case, and if the situation changes, certainly from my understanding of both law enforcement agencies, they will change too.
And just further to Kellyanne's question there, I heard from some long-term care staff last night who said they were quite nervous about new patients entering the home from hospitals. They're not sure if these patients have been tested for COVID before entering the home. I'm told staff are following a ton of measures to keep residents safe, only to be accepting these new patients. What do you say to them to try to allay some of these concerns?
Well, I think, again, that's an education piece. Certainly, we are working across the RHAs to make sure there's a common understanding. By and large, for example, if a patient is going to a long-term care facility or a personal care home from an acute care facility, they have been tested, and that is known to be negative before they go. And in addition to that, the homes have agreed to take them, to isolate them, physical distance them for a 14-day period, just as we would for someone in the community. There is and always will be a constant need for both personal care home and long-term care availability for people in healthcare. That doesn't go away simply because we're in the middle of a pandemic. What we need to do is help manage it, and I think the RHAs have an approach there at the moment.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Yesterday you said if OceanX shuts down, we only have 5 days' worth of food. If you look at the statistics, 90% of the perishables that we receive come in from Marine Atlantic. And because of your comments, people today, for example, are lining up around Costco. Do people really need to be worried?
No, they don't. It's, as I've just mentioned in the comments that I've just made, is that we've been in discussions, and this subject has been around now for a few weeks. And so we've been in discussions with Marine Atlantic, with the trucking industry, even with some of our retailers. So right now we know that there's excess capacity within the system. There's a lot of trucking capacity that are more than willing to step up and respond. We know that Marine Atlantic would have 2 vessels that are not working anywhere close to full capacity right now. And we also know that they have 2 more vessels that are tied up. So right now this is would be the contingency plan that we have in place if indeed OceanX decides to either stop its service into Newfoundland and Labrador, or if it has an impact that would lead to disruption. So we're working with those industries right now. Of course, we're working with the federal government as well to work with OceanX. So there's a lot of discussions ongoing right now, but if there's a disruption or severe disruption by OceanX, the plan will be with Marine Atlantic and the trucking industry to keep goods and service, the essential items, moving into Newfoundland and Labrador. So it's no reason to move from the guidelines that we put in place. Shop once a week, shop for essential items, plan your visits. There will be food security in Newfoundland and Labrador.
You said that the numbers right now aren't sort of the light at the end of the tunnel. I think a lot of people are wondering, what is the criteria you're looking for? What will tell you that we are in the downswing and that things are in fact improving and we can start to lift some of these measures?
I think that's a really good question. Certainly with a 2-week lag for an incubation period, there has been considerable discussion about that. There are criteria in Europe that say 4 weeks without a case. There are some that say less than that. We will cross that bridge when we come to it, and we will use the most up-to-date public health guidance at that point. But then the question is, it's not free-for-all. It's a question of how you reintroduce a return to normality, and that is a subject that my department's certainly involved in discussions with other departments about how that should take place. But those discussions are background and planning. It is really premature to even think about that just at the moment. We need to see what the effects of the Easter vacation period have done to our figures. And only then we'll be in a better position to make any sort of estimate about any kind of return to any kind of normal.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
You said a little while ago that being an island was an advantage for Newfoundland in a pandemic situation. Has it become a liability with the situation with OceanX?
I've often said that. As a matter of fact, when I made that comment a few weeks ago, I also said that being an island in the North Atlantic was a bit of a disadvantage for us. If you look at tourism industry, you look at the way we move goods, people move around the province. It's been a disadvantage or seen by a disadvantage by people in the past. Matter of fact, that was one of the comments that I made. And at that time, I also said that being, isolated and rural and an island, and of course with the big land of Labrador, that was kind of an advantage of dealing with the pandemic, and that remains the case. But in this particular case here, we know that we're relying on, companies like OceanX, and we have to rely on Marine Atlantic. And in some cases, getting goods and services here on a timely basis because we are an island or we're remote and we have the Labrador portion, which is very sparsely populated, of course. So yes, in these cases, it would be a disadvantage to us, but my comment today to people in this province, you have not to worry about food security. We have contingency plans either with Marine Atlantic and the trucking industry to make sure that we get those essential goods and services into our province.
And I also wanted to follow up on the meeting held. Mr. Haggie, you mentioned the meeting with Fisheries and Land Resources last night. Why now have these meetings with from a health focus with people in the fishery, with the FFAW, with other actors? Why weren't these meetings held before from a health perspective, given that we knew that this situation would probably result?
Certainly, there have been regular discussions, as far as I understand it, between the deputies concerned, going back some weeks. I think from the point of view of some of the organisations that we want to talk to, according to information I was given yesterday, at least one of them was not in a position to come to the table with their concerns fully fleshed out and expressed. My understanding, and again, this is information I've been relayed, is that there is no decision about the fishery up until the end of this month. And so my understanding is there's still some leeway there to be had. The important thing is, from my point of view, that I understand and we understand what their concerns are, but equally that they understand what our concerns and what our potential constraints would be from a public health and, if need be, a public health orders perspective too. Because, as the Premier has said, the first thing here is safety.
Our next questions are from Drew Brown of The Independent. Please go ahead.
Mr. Brown, please press star 1.
Perfect. Okay, so given the ongoing contraction in oil prices and offshore exploration, are there any plans to revisit Advanced 2030 plans to double offshore oil production?
Well, these are very early, days into this pandemic, and what we've seen here now are a number of events that would lead, just not from related to the pandemic, but a number of events related to the decrease in oil prices, and we've talked at great length about the impact that is having on our province right now. But Advance 2030 is not something that we're looking at right now to actually make significant changes. It is a bit of a short-term, mid-term, long-term plan. Of course, we were on a very aggressive path when it came to exploration for this year. We were looking forward to some extra exploration that would have been done, some significant investments that would have been made in our offshore. Plus, we also know that the work with the federal government was ongoing with the consultations around, the assessments offshore Newfoundland and Labrador. So, there's still work to be done, but we'll see now as we get through this health crisis, and we'll start putting, these measures back in place, and we'll continue on with Advance 2030, and we'll continue, as we said, to work with those investors within Newfoundland and Labrador, because it is a critical part of the economy here in our province.
Perfect. Thank you. So, given the public health emergency, we've got an all-party committee on public health. So I was just wondering, given the present and future prospects of the Newfoundland and Labrador economy, do you think it's time to convene an all-party committee on economic renewal or restructuring?
Yeah, so I've made, and I know the leader of the opposition and the leader of the third party has made some public comments on this. And I think right now we've had success as we dealt with the public health crisis and the work of the all-party committee. And Minister Haggie is part of all of this as well as some of our other ministers and other members and other MHAs from the opposition party. So we've had some success with this, and I've enjoyed working closely with our opposition leaders and their representatives on the public health issue. I see no reason that we can't continue to work together dealing with the economic crisis as we come out of this health crisis. I think there's a lot of value in that, and it's a part of this health crisis that I would see has been a positive one. I think people view it as that as they've watched us work together, at this critical time in our history.
Perfect. Thank you.
Our next questions are from Holly Mackenzie Suter of the Canadian Press. Please go ahead.
Looking at Quebec is now auditing all of its care homes where seniors and patients live on an ongoing basis. Can you give more details about the level of auditing and oversight in personal care homes and long-term care homes that are happening right now?
Certainly, we have a different system than the Régie in Quebec. We have long-term care facilities designated as such, and these are, with the exception of one, run by the regional health authorities and an integral part in a very similar mechanism to acute care. We have the Patient Safety Act, and that has generated a significant level of comfort, I think, in staff in terms of quality of care and quality assurance, quality management processes. The personal care homes for clients who require somewhat lesser levels of care than long-term care is by and large a privately operated sector. They are licensed by and supervised by the regional health authority directors responsible for community support services. What has happened over the course of the pandemic is our regular dialogue has increased. We again have been working with them to educate them, to help them in terms of supplies of PPE kits and advise them about cleaning and isolation procedures. And that's worked very well as far as we can tell. The issue about inspections and these kind of things, certainly those visits have increased. And at the moment, I'm not hearing from any of the personal care home residents or their families that there are any significant areas of concern that are being overlooked. So I think we may be comparing apples and oranges, given the situation in Quebec, the way they run and the way we run.
Okay, but in terms of inspections, I mean, given that things can change pretty quickly, can you say how regularly, the personal care homes and long-term care homes are being visited, formally to be inspected?
Well, the long-term care homes, as I say, are different. I mean, they are equivalent to being in a regional health authority facility, because that's what they are. So we inspect and accredit RHA facilities on a completely different cycle. But there are quality control teams and quality management teams within regional health authorities who are responsible for looking at long-term care, just as they are for acute care and surgery, medicine, coronary care, this kind of thing. As far as the personal care homes are concerned, they are inspected regularly. The frequency changes depending on which element you want to look at. So, for example, dietitians will visit at random as well as on a regular, say, quarterly basis. In terms of infection prevention and control, then they have been engaged very much around some of the issues I spoke of before. In terms of isolation, in terms of cleaning procedures, in terms of educating staff around PPE where appropriate. Some homes have a greater need for that education than others. Some homes have registered nurses as part of their staff, others don't. So it's very much tailored to the individual area and the homes that are operating there.
We will now start a single round of questioning, and the first question comes from Peter Jackson of The Telegram. Please go ahead.
Given the burgeoning cloth face mask industry that's been springing up here now since the recommendation to wear them in public, is there any consideration being made to opening fabric stores or giving them some kind of essential status?
At this time, no. We certainly wouldn't want to open retail stores. People are making these from their homes, and there's also other businesses that have supplies to be able to make these that are currently making them. So at this time, no, there's no plans to open up retail stores for that purpose.
The next question is from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. We're seeing a lot about vaccine trials happening elsewhere in Canada University of Calgary working on one. Is there anything in particular the province is doing in terms of vaccine work?
The short answer is we're watching the national scene and the international scene. We have no background in manufacturing of vaccines, and what trials are conducted in this province are usually done so through either private companies or educational facilities. From the point of view of vaccines, certainly we would be interested if anyone felt that we had something particular we could offer. But the facts of the case are these trials have traditionally been done in larger centres, and in actual fact they've often been done through mechanisms that don't involve this province. If anybody felt that there was some particular area of collaboration that we would like to participate in, certainly that's a discussion I'm open to have. But the department, government, has never sponsored drug or vaccine research directly. So that would be a new step, and I'm not sure whether the trials you're referring to are actually, in a sense, sponsored by the provincial government or simply taking place in a traditional academic setting, such as the University of Calgary. But certainly, long term, a vaccine for this condition would be extremely helpful, with the proviso that, it may be like the flu. This year's vaccine may not work on next year's. Those are open questions we haven't had answered yet.
Thank you.
Our next question is from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
Thank you. According to the Cape Breton Regional Police, over the weekend, a Marine Atlantic passenger arriving from Newfoundland was sent back to the province because the individual didn't have a place to stay in that area of Nova Scotia. Are cases like this common, and what's being done to provide housing in these cases?
I'm not aware of anybody on our side who's been in that situation. If you had any details, I'd be happy to look into it. Our instructions, our requirements are that anybody who gets off the boat or the plane coming from out of the province has to self-isolate for 14 days, and they should go straight to their address to do so within the bounds of reason if they have to get gas or whatever to get there. We're not aware of any such situation on this side of the ferry.
Okay, it was a press release that was sent out. It was someone from our province. They'd landed in Nova Scotia, and then they were sent back to our province.
Okay.
Thank you.
Our next question is from Ben Murphy of VOCM News. Please go ahead.
Minister Haggie, in July 2017, you announced the implementation of a shared services model for supply chain management. And you did say it would take 5 years to implement back in 2017. But I was just wondering where this lies now, or if it all kind of just goes out the window due to the pandemic.
Oh, far from it. Our shared services CEO, who's been front and center with the procurement piece during this pandemic. Indeed, our original pandemic order, which was put in January, was done through that mechanism in addition to our regular order and our kind of influenza supplement. No, they're actively involved and have been instrumental in getting some of our deliveries. In addition, we've brought in some other streams that we've talked about through Eastern Health, through looking at non-traditional sources and having the capability to test that equipment if it's available to see if it passes muster, as well as looking at private sector manufacturing. But shared services and centralized procurement has been key in this.
Perfect. Thank you.
Our next question is from Peter Cowan of CBC News. Please go ahead.
Home care workers continue to often work for multiple clients. Is there any move to restrict them to just working with one person? And what's the concern if they are then interacting with multiple different clients?
We have an even more fragmented industry when it comes to home support than we do with personal care. And that is probably going to be the knottiest of the problems to unravel. A significant proportion of home support is delivered by what we call direct managed support workers. They actually are arranged by the client themselves. And so we and government have very little way of identifying what that individual might do in the afternoon when they're not looking after Mrs. A. So that's one element. The home care agencies are easier to contact and easier to actually identify the magnitude of the problem, and that's currently underway. But again, a lot of their problems lie around the fact that their workers may be providing, an hour of care to one lady and 2 hours of care to another gentleman on the same street. And that is going to be much more of a challenge. Certainly, we have open discussions with the home care agencies, but by and large, they represent around 40% of the delivery of home support. So it's going to be a real challenge, and we've started working on that, but it's going to be quite a lengthy process. And it worries me.
Our next question is from Patrick Butler of Radio Canada. Please go ahead.
I want to ask a final question on OceanX. The timing is interesting. A month ago, the Supreme Court of Canada refused to grant leave for appeal for OceanX in its fight to get a subsidy from the federal government. We know they've lobbied Ottawa for years for federal subsidies, given their main competitor is Marine Atlantic. Does the timing of this situation with OceanX, is it something you're questioning? Is there any opportunism at play here?
Well, I'm not all worried about the timing of it. That's not my focus at all. My focus is about maintaining food security for Newfoundland and Labrador. So how a particular private company would respond and, given the situation that they currently find themselves in as a business operator, that's not my concern. My concern is what the fallout would be, what the impact would be on Newfoundlanders and Labradorians, and we will explore all the options, the things that I've just mentioned, Marine Atlantic and the trucking industry, and looking at operators or retailers, in this case, grocery store operators, expanding inventory and so on. So we have a number of options. That's what's important to me, and the business case that will be made, for all the other things that some private operator would need to consider. Well, that's up to them. My focus is on food security for the province.
Our next question is from Drew Brown of The Independent. Please go ahead.
I guess this is a question more for Dr. Fitzgerald and Minister Haggie, but do you keep track of people who call into 811 with possible symptoms or concerns, but who are turned down for testing?
We can get the data from 811. We haven't actually tracked them in a formal way, but we could certainly... You see, 811 isn't just there for COVID-19. 811 has been there for many years and provides a really valuable service, particularly for rural areas, whereby you can get medical advice from an RN and be advised appropriately. It's seen a huge reduction in the number of out-of-hours visits to emergency rooms, for example, over the years it's been in place, by as much as 50 to 60%. So it's not just for that. We can break down the distribution or the disposal, if you were, of the calls, and we'll certainly do that for you if you think it's going to be helpful.
Yeah, so Minister Haggie is right when he talks about and describes the 811. And over the last 10 days, as an example, some information that we were discussing this morning with our all-party committee, and that over the last 10 days, we've had just over 400 calls and a high just over 600 calls, and that's within the last 10 days. So it shows, how important 811 is to, residents of Newfoundland and Labrador, and where they're going looking for information. But that's an important tool that we've had even prior to, COVID-19, and I expect it well into the future. It will continue to get, a large amount of use.
And the other thing to remember is that people who are symptomatic, who don't meet the criteria for COVID testing, are still given advice as to how to stay at home and to protect themselves and others in their home from the 811 nurses.
Okay, perfect. Thank you.
Our next question is from Holly Mackenzie-Suter of the Canadian Press. Please go ahead.
The personal care homes and home care workers as well. Is there, any requirements right now that they should have to be wearing PPE when coming in contact with patients? And do we have enough supply at this point to make sure all those workers are provided for?
From the point of view of personal care and home care workers, traditionally they have supplied their own equipment or been supplied by their employer, who is usually, as I say, a private company, with their own equipment necessary to do the job. One of the things we have done certainly is provide them with guidelines and protocols for residents in personal care, for example, who may need isolation and how to go about that, particularly if that is not something they're used to. These plans from a pandemic point of view have been there for a while, and in actual fact they are there pretty well every year to some lesser extent because of our influenza season and the fact we have the 2 spikes. What we have done differently, certainly for personal care homes, is bearing in mind their challenges around PPE. We have a stockpile of kits with each regional health authority that a home can access should they have the worry or the need. But again, they are guided by infection prevention and control protocols, which the RHAs have provided.
We have time for about 3 questions. I ask reporters if you press star 1. For those reporters who are able to get their questions through, that would be great. And for the remainder, if you want to email me questions later, that would be fine. Please press star 1 to ask your question and identify yourself, please.
And the first question is from Kellyanne Roberts.
Thank you. Yesterday, we were told roughly 6 to 7 cases were community transmission. I'm wondering if we have a further breakdown for Central Health and the Labrador-Grenfell Health region, knowing that 3 in Central were travel, contact, and community spread.
I don't have that information in front of me right now, but we can certainly get that for you if you want.
Thank you.
Next question.
Ben Murphy, please go ahead.
Thanks. I know the focus is on healthcare, fighting COVID-19 right now, but Premier, you talked a lot about the financial impact of oil prices yesterday. And just further to what Drew said earlier, I was just wondering if government is working on an alternative plan for economic development if oil doesn't bounce back.
Yeah, so we put a plan in place back in 2016 for the growth and sustainability of Newfoundland and Labrador, and there's a number of different plans, sector work plans that have been put in place. And these were designed and put in place by working with the industry leaders at the time. You know, there's no question that given the recent environment that we're in, many of those sectors, many of those industries have been severely impacted. So I think it's always important that we continue to work with the partners that we developed in 2016 and working through those plans. So yes, of course, as we look at the future of the economy in Newfoundland and Labrador, there probably will need some tweaking changes that will need to be made. You could see, as an example, we often talk about the impact of 911 had an impact on travel. There's no question that COVID-19 will have an impact on how we socialize, how we work together into the future. So I think any plan that we have in place for economic diversification will need a refresh, will need a look, and we'll continue to do that. These things evolve. And it's important that we make sure that this province is ideally situated to respond appropriately once we come out of this health crisis.
Next question.
From Pierre Cowan, CBC. Please go ahead.
Other provinces are requiring workers in long-term care homes to wear masks at all times. Are we requiring that here?
In long-term care facilities, workers are being asked to wear masks for their full shift.
Okay, thanks.
So just one more quick question, and then we will end the session. Please go ahead.
Peter Jackson from the Telegram.
Just one last question about personal care homes. What about group homes where you have people with cognitive disabilities or autism, that sort of thing? They also are falling through the cracks, I would think, in this attempt to crack down on worker movement.
Certainly, we have had discussions with our staff about how to identify those people who might cross-work in various facilities like that. It's a work in progress, but it's another area of concern for us too, because, as you quite rightly pointed out, the people who live in those kind of settings will have a great deal of difficulty with the concept of physical distancing and some of the public health measures that the general public might find easier. It is another area that we're concerned about. And again, like some of the more private home support issues, we're trying to unravel that at the moment.
Thank you.
thank you very much for tuning in today. The time for questions has ended. We ask that you come back again tomorrow, 2 o'clock in Newfoundland, 1:30 in Labrador. Bye-bye.
Become